News from Colorado, USA, 2020 Innovation-based optimism for lung cancer outcomes. Owing to advances in prevention, screening, early detection and therapy, lung cancer mortality rates are decreasing and survival rates are increasing. This review provides information on the clinical implications of these innovations that are practical for the practicing physicians, especially oncologists of all specialties who diagnose and treat patients with lung cancer. News from Florida, USA. Early diagnosis with alternative approaches, innovation in lung cancer care. This article offers an overview of several existing screening methods for the early diagnosis of LC. Nevertheless, these methodologies have limitations of reliability towards the diagnosis of cancer malignancy. Therefore, the prospects of different alternative approaches and their challenges to overcome this barrier for the early diagnosis of malignant tumor cells have been articulated in this article. News from Lund, Sweden. New promising treatment uses smart nanoparticles to target lung cancer. A new and promising approach for treatment of lung cancer has been developed by researchers at Lund University. The treatment combines a novel surgical approach with smart nanoparticles to specifically target lung tumors. The new study has been published in the July issue of Advanced Therapeutics. News from Boston, USA. Engineered off-the-shelf stem cells target breast cancer that metastasizes to the brain. In a new study, researchers from Brigham and Women's Hospital and collaborators engineered a bimodal tumor-suppressing and killing molecule that can be delivered to the brain by stem cells. They tested the therapy in 3 new mouse models of BLBCBM that imitate human cancers, and found that it successfully prolonged the lifespan of the mice. Findings are published in Science Advances. News from Malmö, Sweden. 3D mammography reduces the number of breast cancer cases diagnosed between routine screenings. 3D mammography reduces the number of breast cancer cases diagnosed in the period between routine screenings when compared with traditional mammography, according to a large study from Lund University in Sweden. The results are published in the journal Radiology. News from Beijing, China. Going deep, artificial intelligence improves accuracy of breast ultrasound diagnoses. Could deep learning algorithms be the solution to this conundrum? Professor Wen He, Beijing Tiantan Hospital, Capital Medical University, China, thinks so. Artificial intelligence is good at identifying complex patterns in images and quantifying information that humans have difficulty detecting, thereby complementing clinical decision-making, he states. News from Tokyo, Japan. Novel hydrogel carriers for anti-cancer drugs offer new hope for cancer treatment. From Hong Kong, China. New technique traces genetic and epigenetic origins of DNA to reveal hidden cancers. News from Washington, D.C., USA. Novel cancer vaccine targets oncogenes known to evade immunity in melanoma and neuroblastoma models.